So we have olfactory radiation, so nose smell will be affected too. And again, they might be a little bit of drowsy because the blood has been lost and will be dizzy. So one of the things you need to ask is any blood trickling in the throat, and also you need to ask, are you being drowsy or dizzy? Now, if to rule out whether it is anterior or the posterior, you need to ask where this blood is coming out, whether this is coming out from in the front or whether it's going trickling backwards. If it's going from the front, it means it's anterior side of the nose. If it's going from the back, it means it's more like a posterior. I think I'll give you a diagram. I have a diagram in the end. I should have included. Everyone can see this in the part, the diagram. Okay, as it shows, like the poor guys actually pointed out the finger, more common in children and adolescents. So what they do, nose pinching, and what we call is the anterior nosebleed is most common. We have a little's area at the side, okay, and in the front. When I was saying people actually wax their nose or nose pinching, blowing out, forceful blowing, again dry crusting, we heard the little's area. Okay, we have a concus which we actually call the Wood's rough plexus in the posterior bleeding is less common. So what happens is those people would rough plexus is short, W has been drawn. That side is the commonest side where actually people who go for nasal surgery, and that is the place where people actually get a posterior bleeding. Okay, but having said that, that is uncommon, and it is most likely associated, if it is coming from the backward, it is coming from posterior wall, it is associated with surgery and high blood pressure. So they would have a profuse bleeding. They would have in the front, and again profuse bleeding in the backside, the back of the trickling of the throat. Now remember, if at all it's happening profuse, if it's non-stop, that is an admission condition. I think one of my student, I was doing a role play yesterday, and she said, I will discharge you. You never discharge this patient unless and until the medicines of hypertension has been reviewed. You can never discharge them. Don't even do the mistake. And here's the commonest side, because the cranium is attached, the posterior pharyngeal valves, posterior concus. So we are concerned about the blood might migrate to the brain and also go to the tummy. Okay. Now coming back to symptoms. So you need to ask, do you have any nausea, vomiting, any trauma, any picking and sneezing, or weather? Majority of time it starts with the hay fever. Those people have flu, hay fever, seasonal changes. They actually land up having this, night dry crusting a lot. Any URTI. Now, conkers get irritated. I do get that too when I get flu, like my nose get irritated. Sinus and the nose, they are connected. If your sinus are irritated, they will actually cause inflammation of conkers both side, and again, it's going to start causing bleeding. So you need to be actually concerned about allergic rhinitis and the sinusitis. If you're not asking that in the history, you need to ask that, do you get a recurrent nose block? That's the question. Do you get a recurrent nose block? Not like allergic sinusitis right away, but you need to ask that. Do you get a nose block? Do you get about nasal discharge? It's a serious discharge. If a serious discharge, a lot of sneezing, we need to think of allergic rhinitis. If it's a pleural discharge, nose block, get recurrent infection, we have to go think of sinusitis. Sinusitis could be common in children and adult sports, so is the allergic rhinitis. Now, deviated nasal septum, as I said, like many people actually born with the deviated nasal septum, they most likely suffer from foreign body only in children, not the adult. Even though they are actually doing foreign body, what they meant by is any gauze piece left after the surgery or anything. That is a foreign body we get in adults. Now, past medical history, high blood pressure, any recent surgery. If you don't ask any nasal septal surgery or any surgery of the nose, you won't pass this station, because profuse bleeding is a shaving of septum. I'm not sure how many of you have seen ENT surgeries. What we literally do when we removing some foreign body, like for example polyp, we shave the concha of the posterior side, okay, and we also shave the septum of this side so that there is no support wall is there. But when we are removing all of that, we actually make the septal and anterior cartilage very weak, and they easily to break. This is the most common scene in elderly people. So here is the case, you are going to get an elderly lady with the hypertension, taking experiencing like dizziness, having the nosebleed, as well as have a previous surgery. If we're not digging into it, we are not going to get a clear picture. this question in your exam, I doubt you will pass. It's not a bleeding disorder question. Okay, be careful with this one. It's an ENT, so this is you need to be exploring for that. I think we have another ENT question of adenoids because when they love ENT question, they bring ENT together, the peds or adults, so they will bring it that. So in order to make sure that she's stable, she's not having heavy menstruation, and is changing color stool, what happens is people who have a recurrent epistaxis also get melena. Melena not because of they are having cancer, because the bleeding somewhere in the top GIT can come down as your blood. And again, urine can be dark. You can be having a blood. So bleeding disorder will be covered by like that. You don't ask straightforward, do you have a bleeding disorder? Then ENT already doesn't have so much of questions. So you need to ask relevant questions that. And again, family history bleeding disorder. So what are you going to do? You although she will be stable and sitting, you giving history, still even to stop it, you remove the gauze. You will tell I'll remove the gauze. I'll give you vasoconstrictor or something. This is called I don't know how to say cofenal cane forte spray. What does it do? It will immediately stop the dilation of concha. Also stop like it's like a liquid cautery. It will stop it. Your bleeding going on. If it doesn't stop it, then you have to actually call ENT specialist. Now, this is not your case. Epistaxis itself, it's indicated more specialist case. Okay. If you start dealing this case by your own, it's a critical error, and again, it's a key issue. It's not a GP level case, and again, it's not internal level case. It's more like a specialty. I was told even when I was doing ENT postings way back that ENT cases are ENT level. Okay, and epistaxis is one of them. You will be actually getting to be the ENT specialist. What they do, we have these days with nasal gauze, which actually you put some drop and they get dilated. They do anterior and posterior wall dressing, so they will be actually putting up the gauze until the back of the okay. And they will be once the blood stop completely, then they will be removing that. Again, we do not know how to remove it from posterior side, so leave it to them. Okay. I think I'll so you don't need a physical examination in this case, so you need to be actually talking about it. Again, what you will the investigation you will be ordering. In this case, you will be ordering bleeding, clotting profile, full blood examination, CT scan of the head only when you're thinking of trauma. If there is no signs of trauma, but you need to be ruled out. Now, you need to explain the patient what you are being seen. What your condition is called as an epistaxis, which means there is a bleeding of tiny vessels in the nose. Draw the diagram of a little area, and the areas of the septal where we have a blood supply, anterior and posterior side of the nose is supplied, and it's a very vascular. Or by the way, if somebody is taking Sildenafil, which is Viagra, okay, or even drug can cause that. Or not only aspirin, drug Viagra. It can work in little area and cause bleeding as well. Not necessary, it's actually go and work somewhere else, but it can work there as well. So nasal lining, extensive blood vessels can harm your air into your nose, and the tissue become fragile and damaged. Because of this condition, you start having a nosebleed, and suddenly, most commonly in the from the one of the nostrils, which you is having right now. So it is not a serious condition, but since it has been going on for this person, you will be actually monitor, and again you will be treated. So what you're going to do now, you will be actually don't blow the nose instruction. You will be admitting this person to observe, and you need to keep. Now it's like a ESPA action plan, same thing you'd give epistaxis sort of a plan, like in next time what. So first of all, what is we do in when somebody has nosebleed like this? Right now you will admit it. Don't discharge. Let's review by specialist. Okay, but then later on when he's being discharged, you need to tell them this can happen again, and it's very frequent. You would be surprised people who go for surgery once in I think 5 times in a year, 5 or 6 times in a year, they come in with their epistaxis because there is uncontrolled bleeding. Okay, so you need to tell them you need to pinch the nose, elevate the face 30 to 45 degree for several hours sometime, and pinch it like hard. If it for 5, 15 seconds, 15 for to count 15 and release. If it doesn't settle, then you need to come to the emergency department. So trying to they actually as a post-op impact, we always give some nasal cleaner, like we have a nasal spray. So So ask them not to dig in the nose and try to take out the dry crust. You have a nasal cleaner, and that will wash it for you, and you will bring it out. And meanwhile, stop aspirin as such. Okay, if you have any painkiller hypertension, we need to control. And if at all is raised uncontrolled hypertension, so we will be they would be more frequently will have epistaxis. And again, it would be best to assess if this person, along with epistaxis, having a headache as well, because if it's someone having a headache along with epistaxis, it means yes, suggest of high blood pressure. Okay, so right now you will be putting up a tampon, you will be giving a plan, pinch 5 minutes, release, pinch 5 minutes until 20 minutes, it's come back. If it doesn't settle in 20 minutes, come back. We will be applying some cortisone, apply the nasal pad, and for the posterior pharyngeal wall, definitely we'll do IVIS line and normal line and stabilize the patient. Now, where the nasal pack is contraindicated when there is septal hematoma and basal skull fracture, so that's why we take CT scan. If there isn't a recurrent infection in the nose, we always cover with the flucloxacillin. And for the we always apply antibiotic around the area if there's an infection in the nose, like for example ulcers. So we like Bactrim or any other ointment. And again, if the bleeding lasts more than 20 minutes, because you don't know how much the blood they can lose. I think I've seen patients sometimes lose more than 500 ml from just an epistaxis. It has to stop. Otherwise, their blood pressure will drop and they will feel dizziness. They can faint because of bleeding, and they could die because of nose bleeding. Okay, so you won't discharge for this person right now, but in the future, you need to be talking about this as well, how to manage it. All right. Any questions regarding this? That's the fact of epistaxis. Immediate management, you just do the nose back, Sadia. You leave it to specialists. Control the high blood pressure. You give antihypertensive if the person is on hypertensive medication. Pinch the, you will be, nose pack is enough for now, nose pack. And again, you will be giving vasoconstrictor spray to control the bleeding has been going. Okay, because if it is in the nose, it will stop. But if it's profuse, let's say heavy bleeding, it would not stop. It will continue, especially hypertension. So you need to control the hypertension. Renu, you were writing something. I got stopped. Is there a question there? Good. All good. No good. All right. Okay. Let's go to the yeah primary amenorrhea. Why? Oh, come on. I gave a diagnosis already. That's a bad thing. I should make you think rather than giving myself diagnosis. I do sometime then. Overexcited about the case and then give the diagnosis beforehand. Okay, what is this? It says that primary amenorrhea. Okay. It says that anyway in the question. The basically this case came in the exam was, by the way, they don't write case properly, and none of them write case properly. Okay, I don't know why. It was 17 rather than 18 years old girl. Jenny come with the mother, and she's not having a periods for a long time. Like she hasn't started the period. She had all the secondary sexual character developed already for 3 years back, and she never spoken to anybody about this. But she is now in relationship, and she's worried about the pregnancy. So she actually like in the sense she future pregnancy, not that she's pregnant right now. She wants to know it like if her period's not started, what could happen to the pregnancy. Actually, AMC exam questions are very clear, so I'm just telling you this would be the complete stamp. So your tasks are to take a focus history, perform an examination, order an appropriate investigation, discuss your finding, give an advice to the patient. Okay. So what are the causes of primary amenorrhea? So we know that actually it gave a little bit of hint. So what are the causes of primary amenorrhea? Malformation, dear. What malformation I'm looking for? Name it. Name it. Not the malformation like that. Name it. Genital. People speak. Didn't you have your sugar? You know what, in AMRC I keep candies to do role play so that somebody comes in and I'll give a candy. I need to keep it for you. Throw the candy from online. So yeah, speak. I used to do that in university as well, so that they get ADHD and they speak. Yes, what is important hymen? What is IMP? Licia, when you write something, write completely. Okay, what is IMP hymen? Important hymen? Yeah, pituitary adenoma, very good. Imperforate. Heart disorder, very good. Mullerian agenesis, yes. Now, there are a couple of issues about this question. Okay, what are those issues? The thing is, this girl would be having a mom in the room. Okay, so be careful about that one. Psychological delay, physiological. Oh, sorry, psychological delay, physiological delay. Yeah, we say that not physiological, a constitutional delay. Renee, it's a constitutional delay. I read it psychological, my brain. We call that as a. I think I'm in a funny mood. I'm having ADHD. So physiological, not physio, we say constitutional delay. Excessive exercise is secondary. So we have to have a primary causes first, and then next would be the secondary ones. Okay. Step by step, let's talk about the case. Okay, what we are going to ask, what we are the main concerns. Remember, guys, I've noticed something with AMC. Whenever there is a question of Gillick score, whenever there is a question of teen like 16, 17, 18, teen, they are actually picking up on you on confidentiality. Why? Because lady might have not been developed completely, but again at the same time she is below the adult age. He is given 18 exam, it was 17 years old. You're still not adult as consideration in Australian law. And again, mom would be sitting, when there is a parents would be sitting in the consultation room. Regardless, you need to ask your patient permission whether you want to mom and dad to be there. Trust me, there was another teen question came in with bulimia nervosa. The lady would not dig in anything unless and until you ask mom to go out. Okay. If this question, you need to directly talk to the Jenny, talk to the Jenny, like the girl, not the girl. If you're talking to mom, asking sexual history with the confidentiality is very important. If you do not do that, I'm 100% sure you will lose this thing. They're minor things AIMS examiners are failing you for. Okay, not the major thing. They are not concerned like, I mean, they are a little bit concerned about this because I think Australians are very sensitive. I have Australian boyfriends, I mean, Indian but Australian, and trust me, they're very sensitive. They are like too delicated. I feel like, oh God, this is, they're too delicate. So, and again, the approach in the exam, you have to like make a delicated approach to with these patients. Okay, especially the teens. Careful about this. So ensure the confidentiality. And again, if we are talking to the girl directly, it's good, but still you will be ensuring confidentiality because you're going to ask about her secondary sexual because they were at tennis staging. You would be asking from the examiner. As well, you will be asking her development of breast or pubic hairs, which is might not be comfortable. Again, asking about the sexual health life, it's again uncomfortable question. And maybe she might be doing sex, we never know, and she hasn't been screened for STI diseases. It would be quite of a concern. So we need to talk about it. Again, such cases we need to be talking about a little bit about Gardasil vaccine as well, especially the teen ones. Like, you know about the Gardasil vaccine? And I don't know how many of you know that Gardasil vaccine was discovered in Australia by Australian doctor. If you do not involve Gardasil vaccine in the question, AMC examiners are not happy. So you need to do things which makes AMC examiners happy. Okay, so they know about this, and they are old school people. Again, I was teaching yesterday for Dr. Rajit and Satya and someone, Dr. Aliza, and I realized something. Mainly the things about this AMC exam. They love to hear what is happening, and if you're not considering those points, like for example, H. pylori, Gradusol, and Ferndes, they might not be very happy. Okay, so you need to give a points what they want. Again, they are old school people; they are not following the guidelines. So I realized even yesterday when I was talking about lithium in pregnancy, the case people who have said more about the RSCGP guidelines rather than talking less they actually I realized they don't know how to go far. Okay, they are old school technically speaking, especially MC exam. Applying sling for clavicle fracture is still the old school procedure. It's not the new. We have a different slings these days, but still we will do in triangular one. Okay, so is your drug chart. I don't know why the drug chart is outdated from past 10 years. Now the things are in the system, but still we do the drug chart as AMC. So the things are annoying in AMC. They're teaching and they're expecting from us Australian system, which doesn't even exist anymore. Okay, and we have to do it because we want to pass. Okay, but don't overdo things like you don't go and talk about the guidelines which is recent so much. Pap smear, yes, it is being changed and universally applicable. 5 years, yes, you need to talk about it. Rest of it, like talking about management as according to RSCB guidelines. This is because this is not college exam. This is AMC exam. There's a lot difference in that. Okay, and I think Augustine, you were struggling about the thyroid examination. I would not recommend going geeky medics. Geeky medics examinations are incomplete. Tally corner, yes, I will say follow, but those who are in tally corner, please follow. The rest of the video, if you guys are struggling, I'll give you the link of the videos in a separate mail because I searched for it. But they're not all the videos actually cover all the examination. That's why people are doing workshops. Okay, now coming back to the question, differentials. So imperforated hymen, genital malformation, which is Mullaria ductal agenesis, excessive exercise, even like the girls, especially teen, they are very particular about that. None of you spoke about eating disorder. Eating disorder means they are vegan, they are bulimia, anorexia. Other is second most, which we think hyperprolactemia. Turner syndrome, genetic. I don't know why it didn't come out with anybody. Web like neck, and gonadal agenesis and thyroid disorder. Not PCOS, not POF, not those ones. These are your differentials. Okay. And I have given you a diagram as well because you have like direct, indirect pathway which affects it. Now, sometimes these questions they are giving you hormonal profile when before you start. Majority of AMC cases are designed already for 8 minutes. They are not designed, so they will be giving you when you enter in the room or the behind, like in the front of the screen, they will give you already the prolactin is normal, so that you don't ask prolactemia question. They will give you thyroid function test normal, okay, and they will also give you they will give you FSH LH level also normal. So they are trying to suggest you that doctor don't go and ask unnecessary question with her. You ask other questions, which means infrared harm and Mullerian degeneration exercise and talking about the stress, hypothalamic as well, and other things. And this is tricky. This is the where students lose their touch with reality. They go acute psychosis. Trust me, all the gynae cases are like that. They give you hormonal profile right in front of the question, and then they expect you to talk further in investigation. They ask about further management. They ask, I have a hyperemesis gravidum and other cases where further they are asking. They're not asking to rule out all the differentials. They make you limit to think about limited differential. Is that clear with my students at least? I want to make sure that you are clear with that. Yes, no. So you will be getting a hormonal profile outside. Okay. So they want to talk about this. Yeah, they want to make sure that you don't touch unnecessary questions. And from there you have to design your questions. So sensibly look into it, what is given. Okay. And then read the task and go for it. All right. These are the primary causes. I've listed all of them. Okay, even in the front. Okay. So ensure confidentiality. History of presenting illness. You need to be. Have you had met the growth completely? You can ask this way. Have you met the growth completely? So she was like, okay, what do you mean by doctor? Like the breast supplemented, like the teens actually go through the breast supplement, hair, peel hair, or and all. So have you had it completely? Yes, doctor, it's fine. And you need to talk about what about are you thinking like your height? Why I'm worried about height? Because the Turner syndrome, the web neck, and hypogonadism, all of them, these are the conditions congenitally. They could be short. They could be even in Down syndrome girls are even short. So you need to know that is there any congenital problem as well. Okay. So have you been actually grown met the height as compared to peers, Miss Wayne's other kids? Okay. Are you by any chance on special diet? Like in the sense you're only eating vegan? Are you actually trying to maintain the ideal body weight? Or certain? Usually these cases are coming like, okay, she want to be a ballet dancer or she want to be a model. Okay, that means something eating disorder. I had a case something like this, but as it she wanted to be a model, and I was like, okay, so just that's I classified as an eating disorder. But you need to know about that. So in order to make sure, always there two questions should come combined in the sense one after another. So if it's eating problem, they might be that she might be very particular about her figure. So are you doing excessive exercise by any chance? Okay, what is an excessive exercise means? 4 to 6 hours every day, like 4 to 6 times in a day is really excessive in a day. She can do 2 or 3 times, that's fine. But 4 to 6 is like deliberately a lot. So you need to say that, oh, you need to keep it down. Positive, fine. Okay, I need to talk about the exercise. Do you consider this as overweight? Bulimia nervosa, anorexia nervosa, because they are being psychiatric involvement being there, they consider themselves overweight. I'm not sure that AMC has brought so far bulimia nervosa as a video, but never know that they can bring it. They brought the OCD, they brought the PTSD, they brought veterinarian one. I haven't seen any bulimia. I do have a bulimia nervosa video, but then I didn't actually share with anybody. I didn't find important, but I've seen that video in a psychiatry video, and I found very surprising thing. They do complain about having, they don't have a nice figure. They complain about their thighs mainly. So that's the most chief complaint come from them. They talk about the overweight, they're not in right figure, or somebody else is actually better than them. Okay. And again, your body image. So bulimia, anorexia, body image. Do you see check yourself a lot in the mirror? Any change in the weight? It means did you feel like you gained the weight? I usually ask, did you feel like you gained or lost the weight recently? They might be not worried if it's anorexia. They might not be worried even. Like they would be less concerned about their losing weight. Okay. Any weather preferences? Not weather preferences. You can say any constipation and diarrhea, or you feel hot and cold more than as usual. Change in your voice and in lumps and bumps. Again, malignancy has to be there. There is a case called IBS which we have today. I think I have been seeing that since February last this year. Everyone failed that case. Everyone. Okay. Except me. I couldn't bother to take a lot of history in that. But having said that, there's a one people are not digging in that case is malignancy. Any problem like this, you have to dig in the malignancy. It's mandatory. In all cases, you have to dig in the malignancy. And And again, not lumps and bumps. If you will, I remember asking lumps and bumps my role player, and she was like, "What do you mean by lumps and bumps? They either make you annoyed, or you better be asking significant weight loss, because that can happen in the person can become cachectic. Now, either you ask about the milky secretion on the breast, or you can ask any problem. I have heard that the role play was actually giving vision problem rather than giving a milky secretion. Okay, they more like,